Video lecture, Teratogens. How and when do various teratogens affect the developing fetus? How can you summarize the effects of teratogens during the prenatal period? A teratogen is any disease, drug, or environmental agent that can harm a developing organism. The effects are worst during the critical period when an organ system grows most rapidly. The greater the level of exposure and the longer the exposure, the more likely it is there will be serious damage. Susceptibility to harm influenced by the organisms and its mother's genetic makeup. Effects depend upon the quality of both the prenatal and the postnatal environments. Smoking restricts blood flow to the fetus and reduces levels of growth factors, oxygen, and nutrients that reach the fetus. Tobacco is associated with higher rates of miscarriage, slower prenatal growth, increased risk for prematurity, low birth weight, cleft lips and palate, increased risk of SIDS. The more a woman smokes during pregnancy, the more likely it is that her infant will experience growth retardation and neurological problems. More than half of infants born to women who smoke 20 or more cigarettes a day end up in neonatal intensive care and experience some degree of central nervous system impairment. Newborns exposed to as few as 5 cigarettes a day in the womb are more irritable and score lower on standard assessments of behavioral functioning than other infants. Often the small babies of smokers experience catch-up growth after they are born and reach normal size by the time they enter school. But the more their mothers smoked, the less likely it is their growth will catch up completely. And babies of smokers are also more susceptible than other babies to respiratory infections and breathing difficulties. Alcohol readily crosses the placenta to affect fetal development by disrupting neural migration. Fetal alcohol syndrome is the most severe result of alcohol use during pregnancy. Children with fetal alcohol syndrome have a smaller head and distinctive facial abnormalities. Children with fetal alcohol syndrome are smaller and lag in physical growth compared to age mates. Children with fetal alcohol syndrome also show signs of central nervous system damage. As newborns, they are likely to display excessive irritability, hyperactivity, seizures, and tremors. Most children with fetal alcohol syndrome score well below average on IQ tests throughout childhood and adolescence, and many are mentally retarded. Hyperactive behavior and attention deficits are also common among these children. Longitudinal research indicates that more than 90% of children born with fetal alcohol syndrome have mental health problems later in life, including ADHD and conduct disorders. They are also likely to get into trouble at school, break the law, and experience job-related problems. These problems may arise because children with fetal alcohol syndrome are less skilled at interpreting and processing social information in group situations, leading to interpersonal difficulties. Rubella is associated with blindness, deafness, heart defects, and mental retardation in exposed infants. German measles are most dangerous during the first trimester. Damage to the central nervous system, eyes, and heart is most likely during the first 8 weeks of pregnancy. Deafness is likely if the mother contracts rubella in weeks 6 to 13 of the pregnancy. Nearly 15% of pregnant women with rubella miscarry or experience a fetal death. Birth defects occur in 60 to 85% of babies whose mothers had the disease in the first 2 months of pregnancy, and about 50% of those infected in the 3rd month, and in only 16% of those infected in the 4th or 5th months. Today, doctors stress that a woman should not try to become pregnant unless she has been immunized against rubella or has already had it.